Yeah, good morning, Oluchi and Joe. It feels so good to be here. Let me get you up to speed with what is happening in terms of COVID-19 updates across the African continent. I'm taking off from North Africa, Tunisia, where the health minister, Ali Mrabet, has warned that his country may witness a new wave of the COVID-19 pandemic in May this year. What we don't know now is what this particular wave will be called if it eventually comes up. Now, during an interview, the minister stated that the progress of fighting the virus does not justify laxity on the preventive measures while stressing the importance of vaccination. This is something that can never be overemphasized, vaccination. He also added that the war against the pandemic must continue until it is eliminated. It's also important to note here that just on Monday, Tunisia reported 368 new COVID-19 cases, raising the total tally of infections in the North African country to over 1 million cases. A possible new wave in Tunisia. What is it going to be called? How prepared are we as a continent in case this new wave comes to fruition? Talking about that information from the health minister in Tunisia. But let's keep our fingers crossed and hopefully this doesn't happen. But there's some bit of good news coming from Namibia, where the president, Hage Geingob, has announced that wearing of face masks in public places will no longer be mandatory in the country. Now, the president disclosed this during the 41st COVID-19 briefing on the national response measures just yesterday. However, people who are in closed settings such as public transport, indoor public meetings and so on are encouraged to wear face masks, and physical distance of no less than 1 meter must be maintained between persons at all times. The president also increased the size of public gathering, which used to be 500 to 1,000, while fully vaccinated travelers will no longer be required to produce a negative PCR test result upon arrival at any Namibian point of entry, but are instead required to present an authentic, valid vaccination card at every point of entry, talking about there in Namibia. This is indeed commendable if you ask me, even as Namibia's recovery rate from COVID-19 now stands at 97% with a case fatality rate of 2.5%, while statistics indicated that the active cases stood at 222 presently in Namibia. If you ask me, this is a good move. Relaxation is actually happening, some of these measures happening across some African countries, talking about even Nigeria, talking about South Africa, Kenya, Tanzania, and of course other African countries. But one thing that I'm particularly concerned about this morning, Joe and Oluchi, is that announcement from the Minister of Health in Tunisia. Another wave coming in May. Are we prepared? I hope we are. Joe, Oluchi.
Well, I hope we are. I mean, the Pfizer company came out to announce a fourth booster dose, especially for people aged 60 and above in the international community. We know that countries outside Africa are beginning to loosen their guard in terms of the COVID-19 protocols. Less use of face masks in public places, amongst others. But it is a good thing, at least people can relax some way.
Yeah, people should actually get to relax, but we shouldn't just, just like he said, we shouldn't treat this COVID-19 pandemic situation in Africa and across the world with laxity. We need to do what we can. Vaccination is very, very important here. But before I get off the screen this morning, let me just give you the numbers coming from Africa CDC in terms of the numbers across the African continent. The continent has recorded over 11,645,040 cases, while the death toll stands at 251,808, while the number of recoveries stand at 10,759,618. Please, let's do what we can. Let us get vaccinated. Please make sure that you go everywhere and anywhere with the face mask, and also have those hand sanitizers, please. It's not over yet. We have to defeat this virus this year, and we all have to put our hands together. All hands must be on deck, if you ask me, and let's kick this virus out of our continent.
All right.
Thank you so much, Michael. Highly appreciate that. Well, another update definitely coming our way is still the fact that where many have pointed fingers to that's where COVID-19 emanated from, China seems to be in a critical condition right about now. Over 37 million Chinese are actually locked down, put it that way. So no movement in certain areas. It's like rather than the COVID-19 going down in terms of numbers of infected persons, it's actually going up. Well, thank you, Michael, by the way. We'll look forward to talk some more on this later on when you join us again.
My pleasure.